My mum was right, but neither of us knew why. About 7 or 8 years ago, I started digging into omega-3 fatty acids in a lot more depth than I had before, partly for my patients and partly for myself. She used to spoon feed me cod liver oil, which I absolutely loved because it had an orange taste, and she pushed me to eat more fish. And for years now, I've been eating at least 1 can of sardines a day, and some days 3 or more. Now, there was real reasoning behind what she was doing, even if neither of us knew the mechanism at the time. If you're caring for a parent or you're an older adult yourself dealing with low mood, this video is for you. I'm Dr. Michael, and I've spent close to 30 years in medicine working across more corners of it than I probably expected to in the first place. I want to walk you through the actual evidence connecting omega-3 to mood, where it helps, where it doesn't, and what I actually tell my patients. Stay with me to the end because I'll give you the specific numbers I use, the blood test that tells you where you stand, and something about supplement quality that most people never ever hear about. And I think that omega-3 is a background factor that gets ignored. Not because it explains most depression, it certainly doesn't, but because for a meaningful number of people, there's a correctable biological deficit sitting underneath their symptoms that a standard checkup never goes looking for. And as always, none of this replaces seeing your own doctor or psychiatrist. Think of it more as an informational video and an important tool, not a replacement for the tools that you already have. About 60% of the human brain by dry weight is fat. A large part of that is DHA, which is one of the 2 main omega-3 fatty acids. DHA sits inside the membrane of every neuron you have. It affects how flexible that membrane is, and that flexibility affects how well your brain's chemical messengers, serotonin, dopamine, noradrenaline, to name a few, do their job. In simple terms, DHA is part of the physical structure that your mood chemicals depend on. The other omega-3, EPA, works differently. It's mainly anti-inflammatory. And that matters because we now know depression in a lot of people has an inflammatory component. People with depression tend to show higher inflammation markers in their blood, and that inflammation, when it reaches the brain, blunts mood and motivation. Putting it simply, if DHA is the structure, EPA is what keeps that structure from becoming inflamed. These are 2 separate mechanisms. One is structural, one is anti-inflammatory. Now, looking at what the actual trials show, in 2023, an umbrella review, which means a review pulling together many other earlier meta-analyses, which are large reviews, found that omega-3 added on top of standard antidepressant treatment produced a real clinically meaningful reduction in depressive symptoms. Now, this isn't a replacement for therapy or for antidepressants. It's evidence for using it alongside them. Not all omega-3 is equal here. EPA does most of the work. Trials using a high ratio of EPA to DHA, at least 60% EPA, consistently outperform those using DHA alone or even roughly an even mix. The dose that keeps showing up in the literature is around 1 to 2 grams of EPA per day. One study that has stayed with me is actually from 2002 by Pete and Horobin, and in that study they gave 1 gram a day of pure EPA to patients with treatment-resistant depression, meaning standard antidepressants hadn't worked, and they actually saw significant improvement. For a condition that's genuinely hard to treat, that's pretty meaningful. And there's also one group that's worth mentioning specifically because I see this very often in my clinic. Older adults, meta-analysis in people over 60 found that omega-3 at doses above about 1.5 grams a day had a particularly strong effect in this age group. And my understanding as to why this might be happening in people with older brains is that they tend to be more depleted of omega-3, and inflammation seems to play a larger role in depression later in life. And this is genuinely worth raising with their or your doctor. There's a trial that also contributed to how I think about all of this called VitaCog. It ran in older adults with mild cognitive impairment, an early stage before dementia, and gave them high-dose B vitamins, folic acid, B6 and B12. Folic acid is B9. To be clear about what this trial was and wasn't, it measured brain shrinkage and cognitive decline and not depression. So I'm not going to tell you that it's proof that B vitamins treat mood, but what it found is genuinely interesting. The B vitamins slowed brain atrophy, the shrinkage of the brain, and cognitive decline, but only in people who already had adequate omega-3 levels going into the trial in the first place. So in people with low omega-3, the same B vitamins didn't help at all. And in plain terms, the B vitamins needed the omega-3 to already be there in order to work. One without the other did much less. And I'm bringing this up because I've seen a similar pattern clinically in mood rather than cognition. And that's not proof, but it's my own clinical experience, and it's not a controlled trial. But it definitely lines up with what VitaCog found in a different setting. And it's part of why I now think about these nutrients together rather than one at a time. Now, depression also rarely shows up on its own. It often comes mixed with anxiety. And there's a growing body of evidence that omega-3 helps there too. There was a review of 19 trials which found meaningful reductions in anxiety symptoms, especially at doses above 2 grams a day. Now, I want to be careful not to overstate this. It is not strong enough evidence yet to use omega-3 as your primary anxiety treatment, but it fits the broader pattern of omega-3 helping across a range of mood conditions, particularly where inflammation is part of what's driving things. And here's one of the most consistent findings across this research. People with depression tend to have lower omega-3 in their blood, especially lower EPA, than people without depression, which raises a genuine chicken and egg question. Does low omega-3 contribute to depression, or does depression lead to people leading to people eating worse and taking care of themselves less? Well, it's probably both. Now, I'll tell you about one of my many patients who have a similar story, and I'm going to change enough details to protect her privacy. She came to me with long-standing depression that hadn't responded well to treatment. I tested her with her omega-3 index, and it came back extremely low at around 2%. And anything under 4% is considered deficient, and a level of around 8% plus is considered a reasonable, good, healthy level. We brought that number up over about several months and added a B complex alongside it, and her mood improved substantially, enough that both of us noticed it very clearly. And I can't tell you whether it was the omega-3 alone, the B vitamins alone, or the combination, and I'm not claiming that this happens for everyone, but for her and for others I've seen with genuinely low levels, correcting the deficiency made a real difference. Now, if you want to know where you stand rather than guess, get your omega-3 index tested. I think, like any other parameter in the blood, we should be testing this in many people for a variety of reasons, which you'll get to hear more about in coming videos. It's something that doesn't get talked about enough. Study testing over 170 North American omega-3 supplements found that half of them exceeded the recommended limits for oxidation. In other words, they were rancid or well on their way to being rancid. Independent testing from Consumer Lab has repeatedly found the same problem, which is a meaningful share of fish oil products on the shelves fail freshness testing, even when the label looks identical to a good product. Now, rancid fish oil isn't just less effective. The oxidation byproducts themselves aren't something you want to be ingesting. And most people have no way of knowing just by looking at the bottle whether what they bought is fresh or already breaking down. But basically, it's working against what we're trying to do. You're trying to increase your omega-3 levels, and instead you're actually having damaging oxidation products. There are very few companies that handle this well. The one that I personally use keeps the oil refrigerated from the moment it's produced all the way through to when it's sold, with the expectation that you keep it refrigerated at home for as long as it lasts. And that kind of unbroken cold chain is unusual, and in my view, it's one of the most important, least discussed things about buying a fish oil supplement. Which brings me to food, because if you can tolerate it, eating the fish itself is often the better option than a supplement, not just for omega-3, but for everything that comes with it. Sardines, salmon, mackerel, and herring aren't just delivery vehicles for EPA and DHA. When they're eaten whole, especially with the bones, which in canned sardines are soft enough to eat, you're also getting calcium, glycine, and collagen from the skin and connective tissue. You're getting vitamin D, you're getting B12, selenium, iodine, and high-quality protein. And that's all in one food. My only conflict of interest is that I do love fish and wish that I didn't love them so much that I eat them. From a sustainability point of view, I think that sardines are an excellent choice, as they are a well-sustained population of fish in various parts of the world and are extremely low in contaminants such as mercury, PCBs, and dioxins. And personally, I recommend them with a tablespoon of extra virgin, cold-pressed olive oil, and freshly squeezed lemon. So, as I promised, here's exactly what I tell my patients. If you're dealing with depression, omega-3 is not a substitute for professional care. Please see your doctor or psychiatrist about it. But it's one of the few supplements where evidence is solid enough to raise as something to add alongside your treatment, not instead of it. And if you go to the supplement route, look for one where EPA is the dominant ingredient and aim for around 1 gram of EPA per day as a starting point. And from a company that takes freshness seriously, ask how it's stored, check that it's been kept cold. If possible, look up the product on the Consumer Lab website. If you'd rather get it from food, 2 to 3 servings of oily fish a week, salmon, mackerel, sardines, herring, it gets you most of the way there, along with nutrients most supplements can't offer. It is also worth having your vitamin B levels checked and taking a multivitamin of B complex and ensuring that the levels of each constituent fall within the recommended dietary allowances, especially vitamin B6, which is often given at much higher doses than is safe. A daily dose of 10 milligrams of B6 is considered safe for most people, and I've often seen products which have 100 milligrams. I've got no idea why. This is not safe. And there is an important caveat with fish as well, in that particularly sardines, can be high in purines, which raise uric acid levels in the blood and can precipitate gout, which is an extremely painful condition of the joints. So if you have a family or a personal history of gout, you need to be more careful, and it's a better idea to consider taking a supplement such as omega-3 of a high quality, or algal oil if you don't eat fish. Now, either way, again, consulting with your doctor is important. I do not believe in guessing, and I do advise my patients to consider getting their omega-3 level, their omega-3 index level tested, and to be patient, because most of the trials that I've mentioned ran at least 8 to 12 weeks before showing an effect. Your brain is a physical organ with real nutritional needs. Omega-3 and EPA in particular, alongside B vitamins, are some of the things that a depressed brain is most often short on, and correcting these alongside whatever treatment you're already getting can make a genuine difference. And if this was useful, please subscribe and tell me in the comments, have you tried omega-3 for your mood? Did you notice anything? Have you tried B vitamins? This is The Accidental Doctor, where we try to make sense of uncommon sense medicine. In the next episode, we're going to stay with the brain, but we're going to move further down the road to dementia, cognitive decline, and what omega-3 and B vitamins together may do to protect an aging mind. I'll see you then. Thank you for your curiosity, and ciao for now.